Welcome to this episode of Time Out with GC. Seasonal change, and we are nearing October, or the beginning of October very soon. And with us in studio is an allergologist, Dr Thulja Trikamjee. Thank you for joining us right here on Time Out with GC.
Thank you very much, Kershawn. It's always a pleasure to chat to you.
We've just gone from winter into spring, summer approaching, times are changing, and so is the environment.
Yes, definitely. The environment in general, as it changes every year, and most people, when we're in our adulthood, we would have known that we experience a bit of a change if we do have allergies, which are so prevalent. But I think now why it's more important is because climate change, which is currently such a topical issue worldwide, has had a huge role on allergies and people with seasonal allergies. So with climate change, because our temperatures are projected to increase, and what global experts are saying is that our temperatures should increase by 3 to 4 degrees Celsius by 2060. And that's a huge increase worldwide. And with temperatures increasing, it changes the duration of some of our allergenic seasons, so to call it. So your spring and your summers are longer. So if you're allergic to things that you're exposed to in spring and summer, which is your grass pollen, your tree pollens, and all sorts of plants and flowers, then because the seasons are longer, you're going to suffer for a longer period of time. That's the one part. The second part is that you are going to have the allergens staying up in the air, meaning that they're airborne for a longer period. And when the allergens are in the flower or when they're on the actual plant, that's not when they're actually the most allergenic. They're the most allergenic and cause the most issues in people when they're up in the air. So staying up in the air is really bad because it gets into your eyes, it's going to get into your nose, and that's when all the trouble starts.
For most people, that when symptoms appear, they normally go onto their phone, smartphone, and they want to know the symptoms that I have are the following.
Yes.
And then it's an array of symptoms. And once again, you go and you go, oh, I might have that, I might have this, I might have that. And then it's alarm bells.
Yeah, you know, I think I've had a patient of mine who's come and told me that according to what they had Googled, they have died about 17 times because a lot of the symptoms you find are what we call symptoms that can overlap in so many different conditions. And allergies in particular presents with symptoms which are so common. So the common cold, which everybody is going to get at least 2 times a year, whether you're a child or whether you're an adult, has so many symptoms that overlap with allergies themselves. So at any point, if you're going to Google a runny nose, a tight throat, a blocked nose, stuffiness, sneezing, and things like that, you know, a lot of other differentials, as medical people, we refer to them as differentials, are going to come up. I think the important thing about Google is, and I always say that we live in the digital era, and as doctors we have to be up to date with the fact that we're seeing patients all the time who are going to Google. There's no way of stopping that. I mean, we Google things all the time, even non-medical related. But patients need to understand that Google is something that's more sort of, I tell my patients, a measure of when to panic and when to worry, and when to go or not go to a doctor. Google is not something that you can use to diagnose. The main reason is that our human bodies and each human body is so vastly different. So somebody's body needs to be examined for that particular symptom before you can just go through a blanket Google website that's going to dish out some sort of diagnosis and then give you advice.
Now, talking about Google, if you do Google registered allergologist, you'll find out that Dr. Trikamjee is only one of a handful, less than 8 doctors in South Africa, who's a registered allergologist. So she knows what she's talking about. Your love for allergy goes way beyond just studying it and qualifying.
Yes, so I think we chatted before about how I ended up in allergy and the fact that I think now it's sort of serendipitous, I think, if that's how I may put it, that I ended up here. I don't think I should have or could have enjoyed, I don't think I could have enjoyed any other specialty as much as I enjoy allergy, primarily because there are so few of us. The the ability to make a difference is so huge, because you can actually go out and connect with so many different people, because allergies are so prevalent, extremely prevalent. And living in a country where there are so few allergologists, I think it's a nice feeling to know that you can, as one person, make such a huge difference to so many different people. By consulting with them and assessing them and seeing them, but also on platforms like this, where people with allergies can learn and see that they're not alone, that this is not something that's a life sentence. It's something that they have options to treat. It's something that they can seek help for. And it's something that is, in many instances, treatable and curable.
Talking about that, most people are misdiagnosed because they either go to a GP first, or they go to someone who's got a diploma in allergy and not an allergologist, as in a specialist. You are smiling right now, but I know that the work that you do goes beyond just your normal day to day.
Yes, so I think with allergy, there's such large misconceptions. Because it's so prevalent. So I'll give you an example, Gershon. I often will see a child who comes to me, and while I'm asking questions to the child, and often, when it's a child who needs to visit a doctor, you'll find their siblings come in with model support, and both parents are there. And while I'm chatting and while I'm speaking about symptoms in the child, you'll get either the grandmom or the father or the mother alarm bells going off in their heads, and they saying, well, wait a minute, we have those symptoms. That's exactly what goes on with us. And then 2 weeks later, I get a knock on my door, and in comes that parent, having had made an appointment either for themselves or for their other child. So there's a lot of misconceptions of allergy, starting first with, oh, well, it's normal. And I can start with myself, growing up, thinking that, it's normal to wake up in the middle of the night and blow your nose, or it's normal to wake up in the middle of the night and turn from one side to another. It's normal that if you're in a classroom and you're writing an exam, your nose is dripping and you need to keep tissues in your pocket. These are all things that people have grown up thinking, well, I've got it, I'm just going to live with it. It's just hay fever, it's just sinusitis. And in terms of the work I really enjoy doing is, firstly, creating that awareness of people knowing that this is something that is treatable, and then more so helping people to overcome that. Because the effects of something as simple as allergic rhinitis and hay fever, which is so prevalent, estimates around the world, they vary, but plus minus 30% of all human beings alive suffer with allergic rhinitis. Some of them are mild, but many of them are moderate and severe. And suffering with your nose is the one aspect of it. It's the quality of life effects that something as simple as a stuffy nose brings, which is so problematic. So with children, links have been associated with allergic rhinitis, with poor school grades and school performance. This is stuff that I studied when I was doing my fellowship in allergy, and now in my practice I see it. I'm actually seeing for myself kids who get put onto proper treatment, and then a year and a half later I get the mums coming to me and telling me the school reports have improved. So when your nose is stuffed up or snotty or blocked, your sleep is affected. And this was proven with sleep studies done in the first world with people with allergic rhinitis, because you keep waking up in the middle of the night. When your sleep is disturbed, it affects your wakefulness during the day. So concentration in a classroom for a child, concentration while you're driving for adults, concentration in the workplace, during meetings, and then feeling sleepy as well, yawning throughout the day. For a child, that's not normal. And very often I speak to these kids and, I ask them these questions and they say, yeah, those are all the symptoms that we have. But nobody's actually realized that, it's the allergies that are causing it. So it's really great that in terms of simply educating people and creating advocacy for allergies, you can then get people into the right direction of feeling better and making a difference in their lives.
Well, it's making a difference in their lives. And joining us this week on Time at Allergies is Allergologist Dr Trikamjee, right here on Channel 263. Dr Trikamjee, let's talk about the pollen count in Cape Town. You are based in Cape Town, but you work all over South Africa. The pollen count is extremely high at the moment in Cape Town. What does it mean?
Absolutely, absolutely high, Gashan. In fact, in the
Just
last...
for a normal person to understand.
Yeah. So the pollen that's in the air is the pollen that's a problem. And when we do pollen counts and when we do pollen monitoring, that's the pollen that we're really actually measuring. Cape Town is always, I wouldn't say bad because I love Cape Town, I'm sure you do too, but Cape Town is not a good city in terms of the exposure of different allergens because you've got the mountain, you've got the ocean, so you've got the mold. The mountain gives us all the pollen because it's full of green. We've got the ocean, and then we've got also dust mites. So you've got absolutely all the pollens and all the dust mites and the molds affecting people who are in Cape Town. Cape Town, particularly in the last 5 years, so allergies in general were always a problem here, but in the last 5 years with our weather pattern, if you take Cape Town in isolation, our drought affecting our rains, and what rain does is rain actually washes away a lot of the pollen that's in the air. Rain also brings with it humidity, a certain humidity level, and that humidity level, when the water in the air is competing with the pollen itself, then you find that there tends to be less pollen in the air. With our dry spell that we had, it just took the pollen up to almost a 10-fold increase. So, and that was grass pollen and tree pollen. If you take Cape Town out of its isolated state and then we now put it onto the global map, Cape Town is experiencing climate change like the rest of the world. So increased temperatures, increased seasons, so you've got a lot more pollen, and the increased temperatures also make drier spells which keep the pollen up in the air for a longer period of time. So our tree pollen in Cape Town currently is very, very high. Grass pollen is due to start as we get warmer and we get more into our summer months. And all the way up until February, March next year, we are monitoring it, but we'll find that tree pollen and grass pollen is something that's been spiking.
Let's look at some stats that we just came about. We spoke about this earlier. Asthma, 1.8 million children in South Africa have asthma. Globally, that means we're ranked 4th, and that's between the age group of 5 to 34. That is quite high.
It's extremely high. It's really, really high. Most people don't realize that asthma is very largely an allergic condition. Another statistic that's important is how high South Africa ranks in terms of case fatality rates for asthma. And that figure is particularly high as well. Asthma is something that is very scary when you're a parent and a diagnosis is made in a child. And that's why a proper assessment from the time your child starts wheezing is so important. Very often, and I'm going to twist the story there a bit, in terms of people who don't have asthma, but very important, young children from the ages of about 6 months, very common in 1-year-old, 18-month-olds, up to almost 4 or 5-year-olds might wheeze very often. Seasonally, when pollen counts are high, during winter seasons, if they have issues with house dust mite, and also during viral seasons. So just an influenza virus or a simple RSV, which is common among kids in creches and in play school, might wheeze, in terms of their chest and their lungs getting triggered. Now, a lot of these children don't have asthma. They're actually wheezing, and we manage them with treatment that you would usually use for asthma. But treating them correctly and managing them correctly is so important, because that is where we actually start in terms of asthma prevention. We don't want these children to get asthma, and we don't want those statistics that you just read out now in South Africa to rise. So I always feel in terms of doing something to reduce our statistics in terms of confirmed asthma, our mortality rates and our case fatality rates, it's important to attack the pediatric population where the wheezing has already started with inflammation in their lungs, so that they're not going to become merely another statistic.
Look at those statistics right now in South Africa. If you look at how South Africa is put together, you got your LSMs, 1 to 4, 4 to 7, 7 to 10. That 1 to 4 or harboring on 5 are people living in townships, are people living in Wendy homes, are people who don't have running water, they don't have electricity, but they have smartphones.
Yes.
How do we breach that gap?
So it's an unfortunate situation, not just in South Africa, but many third world countries. And I think even first world countries have this problem with the lower socioeconomic groups and lower LSM groups. I'm currently involved with a company where we're working at trying to break myths with mums and reaching out to communities in areas where people don't have access to seeing a specialist or a super specialist. And the way we're doing this is creating an app. And obviously homework was done by a committee to check that cell phone reception data and the possession of a smartphone is prevalent in these groups. And we're creating an app which is free of charge to most of these mothers. And that's where, as doctors, it's our opportunity to give them the correct information. So, for example, some of the very important guidelines in terms of allergy prevention, we're proving in a South African study that South Africa and our Black African ethnic population in South Africa is showing the same rise in food allergy as the rest of the world. But how much are we doing about it, especially in those groups? So with developing this app, we're actually reaching out to mums who can't necessarily watch DSTV or seek the advice of an allergologist in a private facility or travel a great length because it might cost them money. And simple things about when to introduce foods into their diet, how to know or identify an allergic reaction, what's healthy for their babies is going to be available to mums. So it's something that's very exciting and something I'm really looking forward to rolling out.
Are you allowed to tell me when this will be rolled out?
So the app will be coming out live with the company that I'm working with in October, at the end of October. I'm sure we will be advertising it, and then after that, we probably will be rolling out some educational videos and some talks and articles on a regular basis, which would be very nice. And the best thing about it is that freely and completely accessible to everyone from every socioeconomic group.
Looking at some stats here too, eczema. We were talking about this earlier also. Rhinitis, hay fever. You're talking about that very much too. You wrote an article on this too.
Yes. So, with eczema, the first thing is that mums panic about eczema. They really, because
sorry to
I
break
think
your word, any mom, if you have a kid, first time, baby, anything that happens, you panic.
yes, absolutely, absolutely, and I think with good reason. Mums obviously in a child, because they can't speak. And I always use that to reassure mums who feel, they come and they say, well, am I being too crazy? Am I really being psychotic? Am I being, I might. But I think the problem is that with children, they don't really speak. And with babies in particular, they can't really tell you where the pain is or where the issue is. So mums in general are always at high alert when it comes to anything that's out of ordinary. I'm not even going to say disease, anything that's out of ordinary or unusual. It may be just a sleeping pattern, or it may be that the child drank 200 mils of milk yesterday and he's having 150 today. This is something that mums panic about. So it's nice that we are going to be able to give mums advice on when to panic and when not to panic. And then in terms of the eczema, generally the thing about the eczema is that you can see it. It's on the skin. And a lot of allergies in general, because all allergies come from your immune system. So your allergic rhinitis, your food allergy, asthma, and urticaria, which is the hives you get on your skin, and then the eczema, which is a chronic form of inflammation on the skin. It all comes from your immune system. Food allergy, you can't really see until your child is going to eat that peanut or is going to have that first taste of scrambled egg, and there might or may not be a reaction. With asthma, you're only going to know when there might be trouble,
Or
unfortunately.
playing
And when
sport.
it's too late, playing sport, yes, you're right. And that's what we call exertional or exercise-induced symptoms. But eczema is something that I always tell moms is that, you know, you can from day one, and in fact, overseas in Europe, they've done studies looking at the skin and how taking care of it on day 0 of life. So your babies just come out of your body and you're giving the first bath. And from then you can do things to help to limit allergen exposure on the skin. And one of those things is using good emollients, not necessarily expensive, but good emollients which are not packed with chemicals and fragrances and things
What
like
are
that.
emollients?
So an emollient is a cream or a base that you apply on your skin. That's basically what we consider an emollient. And we now recommend that for babies, irrespective of their background history of or risk of atopy or allergy, that all babies should be having their skin properly moisturized from day 0, because your tendency to dehydrate the skin, and something which we in medical circles refer to as transepidermal water loss, but to dehydrate the skin and then the skin becoming dry, which then creates openings in the pores of your skin, removes the fat barrier which is on top of your skin and allows allergens to penetrate. By doing this at the beginning, you're simply preventing and avoiding all of these problems later on in life. So with eczema, easily seen, and it's one of the first signs usually in babies that this child is going to have allergies or suffer from allergies later on in life. It's something which we refer to as an atopic march, where they usually get eczema or what we refer to as dermatitis initially, which then sometimes in some children may manifest into food allergy. And a lot of the children grow out of their food allergies, and from food allergy it then can develop into rhinitis or hay fever, which is the allergies that we spoke about earlier. And then if you don't manage your hay fever and your rhinitis properly, and this is why it's so important for us to manage it properly at a young age, later on that can develop into asthma. And that's basically what we refer to as an atopic or allergic march.
It is our guest this week, right here on Time It with GC, Dr. Trikamjee. She is an allergologist, a super specialist, and also a love for pediatrics.
Yes, yes. So after I did pediatrics, I did allergy. And with allergy, I do see adults as well, but I do now miss my general pediatrics. So I tend to hold on to, as do the parents hold on to me, all my patients who were my patients prior to me becoming an allergologist and doing allergies. So, and I think that when you quoted the statistics, I think in general, even if we take healthcare out of the topic, if you want to make a difference, you start with the children. And I think that's the reason why I did pediatrics. So with allergies, knowing that they're increasing so much, when you're doing general pediatrics, you have access to that mum the day that the baby is born, and from them you know, you can make that difference. And that's where the general pediatrics comes in. A lot of people with allergies tend to get constant upper airway infections, get sick all the time. You know, mums might think or say that my child's always sick, always needing to miss school, is always sneezing or coughing, always needing antibiotics. I'm rushing to the doctor every 2 months and he's just not getting better, constantly needing all sorts of flu jabs and flu medication. A very large percent of the time that this happens, it's simply inflammation in your nose and in your airways, which can be allergy related. And when you manage that properly, you're actually now going into general pediatrics and you're taking away all of these quality of life effects that these children are suffering with. So, you know, missing school because they're getting sick all the time, needing antibiotics because they're getting sick all the time, not being able to play outside because they're getting sick all the time. So it's great. And there's a big overlap with doing general pediatrics and doing allergy, because most pediatricians who might be watching this show will tell you that a large percentage, in fact, I'm sure more than 50% of what every pediatrician sees in their practice every day has some element of allergy in it.
Allergies, also not just children staying away from school, it affects adults and also our economy.
Yes.
South Africa loses millions because of allergies, and you know, the pollen count is up, seasonal change, climate change. If you Google, it says stay indoors, close all your windows, close all your doors, and stay away from the pollen.
Yes. So, with allergies, there are so many, it's multifactorial how it affects the economy. And I always say I start with the patient first, because once someone's been diagnosed with an allergy, it depends on what allergy you have. With food allergy, if we start with the cost to the economy with food allergy, and we start with the patient, if you've got a child with milk allergy, they have to then avoid milk and use alternatives. And if you avoid cow's milk, and I always say this, the simple general supermarket milk we buy is plus minus 12 to 15 rand a liter. And kids drink lots of milk. It's really important for calcium, vitamin D, for their bones, for their growth and their functioning. If you're now going into other alternatives such as soya milk, goat's milk, almond milk, with goat's milk, it's double that. If you're going to be feeding your child with milk allergy every day in their porridge, in their Milo, in all their meals 7 days a week, you're packing stuff for lunch, the cost is enormous just with the milk alone and substituting that. If you look at things like almond milk, it's 4 times as much as normal cow's milk per liter. And then just avoiding things, going to restaurants, going to cafes, going to a shop, and knowing that your child can't eat the normal chocolate or the normal cupcake or the normal cookie. You're going to have to find a place that caters for allergies. You're going to have to find items that cater for allergies. Not everyone can afford that. So the cost to economy starts with our people. And that cost in terms of food is huge. If you look at the cost to people in terms of medication they use before they even get to the doctor, every time they have a sneeze or a snuffle, you're rushing off to the pharmacy, you're getting an antihistamine, you might get an effervescent tablet. Your pharmacist is going to give you some analgesia, which is pain medication. All the sinus pain and hay fever and things like that, the drops you're using for your nose, again, massive cost to you constantly over and over again. One of the pharmaceutical companies had estimated in 2014, 2015 that in excess of 100 million rand is spent by South Africans on allergy medication. So this is just over the counter, not prescription medication. This is people who have symptoms who are rushing over to the doctor, to the pharmacy, and just buying medication. So I think that says a lot in terms of how it affects the average person's pocket. And then in terms of the economy, starting with school, if you're not able to go to school because you're sick, you're missing out school days, it impacts on your education. It impacts on school fees because lots of children's school grades get affected. So that has a knock-on effect on their performance and can affect their results, and they need to have more schooling or to repeat a grade. So you got school fees, you got the effect on the school itself. Concentration in terms of people in their workplace, not being able to pay attention during a meeting. Time is money, as we all know. So in terms of your work productivity, when you're doing fine work such as concentration, it's going to affect that. And people who are working in industries where they are required to manage equipment or heavy machinery. In fact, in the first world, if you're an airplane pilot, you're not allowed to fly a plane if you have a diagnosis of allergic rhinitis and you are not well, because they see that as a risk to your ability to concentrate during an entire flight. And I think that alone says a lot about how much allergic rhinitis can affect a person. In terms of the wider economy, absenteeism from work and productivity in major companies has a huge effect on the economy of our country in general. So I think with school absenteeism and workplace absenteeism from recurrent infections, recurrent sinus issues, not feeling well, and then obviously carrying viruses and bugs around at the workplace itself also would have a huge effect on that. The food industry in a country also has a major knock in terms of food allergy prevalence rates, because obviously in schools, if we start there with food allergy, they're going to need to cater for children who have food allergies. So if you've got a classroom where there are 3 children with 3 different allergies, the amount of food, and in a lot of the public schools, obviously the money required, or the money that they have access to provide milk and bread, which are simple staple foods given, is not the same as it might be in a private school. So it has a massive effect on that as well. In terms of our food industry, our restaurant industry, all of these things suffer as a result of people with food allergies.
As we wrap up our conversation, Dr. Trikamjee, in an ideal world, you're one of a handful of qualified allergologists. What would you like to see the health industry, especially when it comes to allergies?
I think that allergies, because it's a fairly new field in South Africa, it has a long way to go in terms of us getting on par with first world countries. There is so much we can do as being a handful of allergologists, and I think we're on the right path with especially getting the message infiltrated down to the general public. I think starting there, and then a lot of our medical doctors also need to get training at university level. So me having been trained in KZN, I think training students, starting with medical students with allergy from first year up until 5th year, so that they can diagnose it and identify these things at GP level, because your GP is the first person who's going to see these things, is quite important. And then I think in terms of where we're going, our Department of Health and our country needs to now start to inject money into departments which need the money, and those are the diseases obviously like HIV and tuberculosis, which are and nutrition, which are a particular problem. But I think our subspecialties, so our pediatric cardiologies, our rheumatologies, our all our super specialties also need to get recognition for our country to now be standing on par with the rest of the world. And I think that our people deserve that. We owe it to our general public to have access to the best of healthcare. I learned in, I think, my 3rd year of medical school, a surgeon, a surgical consultant who I met at Prince Msheni Hospital, who I was very fond of and who was very wise, said one day that there should be no difference in terms of the healthcare you provide, be it public or be it private, or healthcare should not be determined based on the color of your skin and the amount of money you have in your bank account. Healthcare is healthcare. So if a private patient has access to an allergologist, I think a government patient should have access to an allergologist as well. And that is my ultimate dream.
Dr. Trikamjee, thank you so much for joining us right here on Time with GC. Thank you for sharing your knowledge and insight into what allergology is all about. And I'm sure that you've helped a few patients who are sitting there and going, wow, I need this doctor's assistance.
Thank you so much, Kershawn. It's always an absolute pleasure being on your show.
As Dr. Trikamjee joining us right here on Time Out with GC. If you need to get a hold of her, her contact details are on the screen. We'll give an email address and office number. You can get hold of her rooms if you need to book an appointment. The Pollen